Hi, my name is Rayvon Johnson, and this is my Foley checkoff video. So before I go in the patient's room, I'm going to check the chart and just validate the patient's that I have the right patient and the correct physician order. I'm going to gather all my supplies. I'm going to come in the room, provide patient privacy, perform hand hygiene, introduce myself, and identify the patient by 2 identifiers. Then next, what I'm going to do is I'm going to explain to the patient what the physician orders are and what I'm going to be doing. Next, what I'm going to do, I am going to, the bed will be completely lower, so I have to bring it up to my height. On the side that I will be doing the side I'm going to be standing on, I'm going to take the rails down so I can have more slack. I am going to expose the area that I'm going to be working in, and I'm going to drape off the area with maybe a blanket or a sheet. I am going to wash the area with warm soap and water and pat it dry. So before I drape the patient off, I am going to put on clean gloves and palpate for the bladder's distension. Once I do that, that's when I will clean the area with soap and water. I will drape the patient off. Now that I did that, the bed is up to a level where I won't have to hurt my back. I'm going to get the urinary catheter out. And I'm going to keep this bag because this bag is going to be my trash bag. Okay. Then I'm going to open up. And I want to make sure I keep the patient relaxed and explain everything that I'm going to be doing. I'm going to open hand glove. You want to grab the inner fold of the gloves. That's where your hand is going into. Okay, so now that I have my gloves on, this is a drape. So he is a male, my patient's a male, so the position that he has to lay in is laying supine with his legs slightly abducted a little bit. Then I'm going to take this drape, and if it was a female, I would tuck under because I have to go underneath her thighs. But since this is a male, I'm going to lay it right on top because this gives us an extra barrier to be sterile. 2-inch out the border is not sterile. Then next is a fenestrated drape with a hole in the middle. And what you would do, you will put this drape, open it all the way up. Okay, and you want to put penis in the hole like that. Okay, so the fenestrated drape is around the penis. You want to get everything together because when you start, you have to hold the penis with one hand, and that one hand will no longer be sterile. So you want to set up everything in your kit, and now I can put this right there because that is a part of my sterile field. So what I want to do, I'm going to pretend as if I'm going to open this package with the betadine, and I'm going to cover and saturate the patient with, saturate the cotton balls with the prep and put it in my trash, and make sure I drop it from a good distance because I don't want to touch the trash bag because it's not sterile. And you want to make sure that your patient's not allergic to betadine also. Then you have your saline. You want to connect that because it's going to be difficult to connect it when your one hand is dirty. So you want to have that ready. And you want to make sure there's no bubbles in there too. Okay. Make sure that's on there tight. Because my patient is a male, I'm going to insert the penis with lube. If it was a female, I will pop the top on the syringe or squirt the lube into the tray. Get the lube ready. Okay, and then I'm going to take the cover off my urinary catheter, and I'm going to watch how I do that because I don't want the catheter to flap everywhere. Drop that in there. Okay, so now what I'm going to do is, everything is ready. My cotton balls are saturated. You want to grab the penis and you want to kind of pull up. Now, If the patient is not circumcised, you want to take extra cleaning measures, and you want to retract the skin of the penis if they're not circumcised, so you can actually see the urethra of the penis. You want to take the cotton swab, and you want to start at the tip of the penis, and you want to repeat this process 3 times. And when you throw it away, you want to go around your field because that cotton swab is no longer sterile. Okay, so now that I'm done with that, I'm going to insert the lube into the tip of the penis. Okay, once I do that, drop that in there. I have already measured to make sure I have the right size catheter for the patient. So now I'm going to just put the tip of the catheter inside the tip of the penis as I'm pulling up on the penis, and I'm advancing the catheter until I start to see urine and I get some resistance. Once I do that, I am going to inject the saline to blow the balloon up. Okay, once I do that, disconnect the syringe. Okay, so now that I've did that, I'm going to pull back and get some slack now that the balloon is inflated. Once you feel a resistance, then that means you're at the right area right there. So then once you do that, everything is done. You want to kind of clean everything up, clean the patient off. You want to make sure that this is clamped also, because if not, the urine is going to come out. So you want to make sure your bag is clamped. When you put it down on the side, you want to make sure that you give enough slack for the patient before you clamp it to the patient's thigh, so it won't be pulling. And then what you'll want to do, I would tear this so I don't go back over the penis. So I would tear that, clean everything up, and ask the patient, is there anything they would like me to do? Also, during the process of everything, I will be talking to the patient, and make sure that the patient is fully relaxed and explaining what I'm going to be doing, and probably explaining to them what they're going to be feeling, a low pressure, just to keep them at ease and talk them through it. So that's the end of it.